peroneus brevis runs forward to insert here, on the base of the fifth metatarsal. To see the remarkable course of the peroneus longus tendon, we have to remove the entire sole of the foot. Peroneus longus runs around the cuboid bone and along a deeply placed fibrous tunnel to insert right over here, on the base of the first metatarsal. Lastly, in front of peroneus brevis and longus, here's peroneus tertius. Peroneus tertius arises from here on the fibula. The tendon of peroneus tertius passes under the extensor retinaculum and in front of the lateral malleolus to insert here, on the base of the fifth metatarsal, next to peroneus brevis. The action of all three of the peroneal muscles is to evert the foot. In addition, peroneus tertius, acting along with its anterior neighbors, can help to dorsiflex the ankle. The muscles of inversion and eversion are important because they enable us to stay balanced and upright on a surface that tilts to one side or to the other. Now that we've looked at the muscles that produce movement of the foot, we're nearly ready to move on to the vessels and nerves of this region. Before we do that, let's review what we've seen of the muscles and the associated fascial structures. Here's the investing deep fascia. Here's the posterior crural intermuscular septum, the anterior crural intermuscular septum, and the transverse intermuscular septum. Here's tibialis anterior, gastrocnemius, soleus, and plantaris, and the calcaneal tendon. Here's tibialis posterior, peroneus longus, peroneus brevis, and peroneus tertius. Now we'll move on to look at the vessels and nerves of the region. We'll go from the knee, where we saw them last, to just below the ankle. We'll start with the veins. Here's the leg with the skin removed. To expose the two major superficial veins, two strips of subcutaneous fat have also been removed. Here's the short saphenous vein on the back, and the long saphenous vein on the front. The long saphenous vein passes over the medial malleolus, which is here, and runs up the medial side of the leg. We've seen its more proximal course in the previous sections of this tape. The short saphenous vein runs up between the calcaneal tendon and the lateral malleolus. It goes up the back of the leg and passes through the deep fascia near the knee to join the popliteal vein. To see some of the superficial veins in more detail, we'll remove the subcutaneous fat from the back of the leg. The short saphenous vein, like the long saphenous vein, is joined by a number of superficial branches. The saphenous veins are also joined by several perforating veins like this one, which bring blood from the muscle compartments that lie deep to the investing deep fascia. In the last section, we saw the principal deep vein of the leg, the popliteal vein. Here it is again. With the tibial nerve behind it and the popliteal artery in front of it, it disappears between the two heads.